Have you ever heard of single-arm meta-analysis? Usually, when we think about meta-analysis, we think about comparing two different groups, like drug A versus drug B, or drug A versus placebo. But sometimes, studies have only one group. Today, I'll quickly explain how a single-arm meta-analysis takes advantage of all of that, and why that is tremendously useful. My name is João Evangelista. I'm a medical student from Brazil, and I have a couple of meta-analyses under my belt. And this is the MetaAnalysis Academy, where we teach hundreds of students from thousands of countries the science of making systematic reviews and meta-analysis. In order to understand single-arm meta-analysis, first, we need to understand what is a meta-analysis to begin with. Now, in a typical meta-analysis, usually what we do is that we mathematically combine studies that are similar to each other. Usually that's comparing two groups. This could be several studies comparing drug A versus drug B, or this could be studies comparing drug A versus placebo. Here's an example. This is a meta-analysis by Randerson, who is the MetaAnalysis Academy founder and my teacher. This is the guy that taught me meta-analysis. This particular meta-analysis, which by the way was heavily cited in medical literature, included 15 studies that compared the efficacy of SGLT2 inhibitors versus placebo for patients with heart failure. And it tried to understand if it would reduce all-cause mortality. Basically, they gathered all those studies and they used math to combine them together. Amongst other things, they concluded that patients using the medication, the SGLT2 inhibitors, had significantly lower all-cause mortality when compared to patients using placebo, because the hazard ratio was statistically significant and lower than 1. If you don't understand all of this, don't worry, because we have other videos here on the channel explaining exactly how the forest plot works, how meta-analysis works, etc. So just bear with me, because I'm going to explain the rest of systematic reviews and meta-analysis specifically for the single-arm meta-analysis. Let's go. The fact that they concluded for sure that there was a benefit, that there was a reduction in all-cause mortality for that specific drug, that is a big deal. Drawing very specific conclusions like that, using math and statistics, that is powerful. Doctors all over the world are going to use that to prescribe medication from here on out. Now, in a single-arm meta-analysis, things are a little bit different. What it does is, instead of comparing drug A to drug B or drug A to a placebo, it will summarize outcomes over multiple studies. And these outcomes can be very, very specific, like success rates or side effects. Let's take this real example. A single-arm meta-analysis on oral isotretinoin for acne. Researchers combined 30 clinical trials with more than 3,000 patients, all of them treated with oral isotretinoin. And what they wanted to do was understanding adverse effects of this drug. They were not comparing isotretinoin to any other drug. They just wanted to understand the safety profile. They wanted to understand that in a bubble. They calculated how common different side effects were, like headaches, dry skin, dry lips, dehydration. For example, I'm going to give you this table right now. In the isotretinoin study, about 35% of patients experienced excessive thirst, and 58% had dry lips. But that's not the only thing that they found. Like they were working with a very extensive list of side effects. In this method, it helped doctors and researchers all around the world make conclusions about the safety profile of that drug. Now, let's say that I'm a dermatologist and I want to prescribe oral tretinoin to a patient of mine, and they ask me about, what's the safety profile for the drug? Like, what side effects can I expect if I take that drug for acne? You can quickly go to the meta-analysis as a doctor and then say, well, there's about a half chance that you're going to have excessive thirst, and there's like 33% chance that you're going to have headaches. And you can give a very accurate response to your patient, which is great. Even if the patient does not want to understand the safety profile, doesn't ask about it, you should, because there are a lot of side effects for some of these medications. Oral isotretinoin can be teratogenic. So if you're going to provide that to a woman, let's say in her, potentially fertile years, then she should probably also be on birth control, because you don't want the teratogenic effects for the potential fetus that she could carry. Or even talking about very serious conditions against that drug, like drug reactions, like Steven Johnson syndrome, stuff like that. You need to understand that, and you need to understand how rare those things are. That information is very, very, very important. So let's just recap. Normally, a meta-analysis compares something, usually a drug, against something else, usually another drug or placebo. A single-arm meta-analysis, however, is a powerful tool to compare events related to a drug or to an intervention across multiple studies about that same intervention, about that same drug. Single-arm meta-analysis is great when you're summarizing or profiling outcomes for a particular drug, like adverse events or rate of response to the drug, or lab changes. Like, let's say that you're talking about olanzapine and you want to know like how frequent is febrile neutropenia after you take that drug. That would be a great systematic review and single-arm meta-analysis. Anyways, that's it from me, guys. I hope you now understand what single-arm meta-analysis is, and if you want to understand how to make meta-analysis from scratch, click the first link in the description. That's it from us. Bye bye.